Mastering SOC 2 for Healthcare. Only a handful of healthcare insiders truly grasp how SOC 2 safeguards patient data. Who within a healthcare organization can explain the purpose of SOC 2 and how its trust services criteria, particularly security and availability, specifically apply to the unique needs and regulations of healthcare organizations, such as HIPAA, to ensure operational excellence and patient data protection? As I walked into the conference room, I could feel the tension. The healthcare organization's leadership team was gathered around the table, looking at me with a mix of concern and confusion. They had just received a request from a major client to obtain SOC 2 certification, and no one knew where to start. The CEO, a seasoned healthcare professional, spoke up first. "We've always prioritized patient care, but this SOC 2 thing sounds like a compliance headache. Can you explain what it's all about and how it applies to us?" I took a deep breath, thinking back to my own experiences with SOC 2 certifications. "Let me tell you a story," I began. "A few years ago, I worked with a software company that stored sensitive customer data. They were growing rapidly, and their clients were getting nervous about security breaches. That's when we decided to pursue SOC 2 certification." I paused, surveying the room. The team was engaged, so I continued. "SOC 2 is all about trust services criteria. It's like a report card for your organization's operational excellence. There are 5 trust services criteria: security, availability, processing integrity, confidentiality, and privacy. For healthcare organizations, security and availability are particularly critical, given the sensitive nature of patient data and the need for uninterrupted care." The CIO, a tech-savvy individual, raised an eyebrow. "So, how does this differ from HIPAA?" she asked. Great question," I replied. "HIPAA is a regulatory framework that sets standards for protecting patient data. SOC 2, on the other hand, is an industry-recognized standard that evaluates an organization's controls and processes. Think of it like this: HIPAA tells you what to do, while SOC 2 tells you how well you're doing it." The room fell silent as the team digested this information. I could see the gears turning in their minds. To break the silence, I offered a practical example. Let's say you have a patient portal where patients can access their medical records. A SOC 2 audit would evaluate the controls you have in place to ensure that portal is secure, available, and processing data correctly. It's not just about checking a box, it's about demonstrating operational excellence. The CEO nodded, a look of understanding on her face. "I see. So, this is about more than just compliance. It's about building trust with our patients and partners." I smiled, thinking back to my own experiences with negotiation. Exactly. It's about building trust and demonstrating your commitment to protecting patient data. And that's where the real value lies. The team began to brainstorm, throwing around ideas and questions. I facilitated the conversation, guiding them through the process of identifying their own controls and processes. As we wrapped up the meeting, the CIO turned to me and said, "You know, I never thought I'd say this, but I'm actually excited about pursuing SOC 2 certification. It's not just a compliance exercise, it's an opportunity to improve our operations and better serve our patients." I smiled, feeling a sense of satisfaction. "That's the spirit," I said. SOC 2 is not a destination, it's a journey towards operational excellence, and I'm happy to be your guide on this journey. Here are the actionable steps I would recommend to healthcare organizations pursuing SOC 2 certification. 1. Identify your goals. Determine why you want to pursue SOC 2 certification. Is it to gain a competitive edge, improve patient trust, or simply to meet client demands? 2. Educate your team. Take the time to explain the purpose and benefits of SOC 2 certification to your team. This will help build buy-in and ensure everyone is on the same page. 3. Identify your controls and processes. Map out your organization's controls and processes, particularly those related to security, availability, and data processing. 4. Conduct a gap analysis. Identify areas where your controls and processes may be falling short, and develop a plan to address those gaps. 5. Implement and test your controls. Put your controls and processes into practice, and test them to ensure they're effective. 6. Engage a third-party auditor. Work with a reputable auditor to conduct a SOC 2 audit, and provide an independent assessment of your organization's controls and processes. Throughout this process, remember to stay focused on the big picture, building trust with your patients and partners by demonstrating operational excellence. Within a healthcare organization, the Chief Information Security Officer, CISO, Chief Compliance Officer, CCO, or Director of Health Information Management, HIM, are well positioned to explain the purpose of SOC 2 and its trust services criteria, particularly security and availability, as they relate to the unique needs and regulations of healthcare organizations. To begin, SOC 2 is an auditing standard developed by the American Institute of Certified Public Accountants, ACPA, that evaluates the design and operating effectiveness of internal controls related to the security, availability, processing integrity, confidentiality, and privacy of a service organization's system. In the context of healthcare, SOC 2 is essential for ensuring operational excellence and patient data protection, as it provides a framework for implementing and maintaining robust controls to safeguard sensitive healthcare data. In healthcare, the trust services criteria of security and availability are of paramount importance. The security criterion focuses on the protection of sensitive data from unauthorized access, use, disclosure, modification, or destruction. This is particularly relevant in healthcare, where protected health information, PHI, is subject to stringent regulations, such as the Health Insurance Portability and Accountability Act, HIPAA. HIPAA mandates that healthcare organizations implement robust security measures to safeguard PHI, including encryption, access controls, and audit trails. To meet the security criterion of SOC 2, healthcare organizations must implement a range of controls, including 1. Access controls, implementing role-based access controls, multi-factor authentication, and least privilege access to sensitive systems and data. 2. Encryption, encrypting PHI, both in transit and at rest, using industry-standard encryption protocols. 3. Network and system security, implementing firewalls, intrusion detection and prevention systems, and regular vulnerability scanning and penetration testing. 4. Audit trails, maintaining detailed audit trails of all access, modifications, and disclosures of PHI. 5. Incident response, establishing an incident response plan to respond to security incidents, including data breaches. The availability criterion focuses on ensuring that systems and data are accessible and usable when needed. In healthcare, availability is critical, as it directly impacts patient care. Unavailable systems can lead to delays in diagnosis, treatment, and care, ultimately compromising patient safety. To meet the availability criterion of SOC 2, healthcare organizations must implement a range of controls, including 1. System redundancy and failover, implementing redundant systems and failover capabilities to ensure that critical systems remain available in the event of an outage. 2. Backup and recovery, implementing regular backups of data and developing a disaster recovery plan to ensure business continuity in the event of a disaster. 3. Performance monitoring, continuously monitoring system performance and capacity to ensure that systems can meet the demands of users. 4. Service level agreements, establishing service level agreements, SLAs, with vendors and service providers to ensure that critical systems are available and responsive. 5. Business continuity planning, developing and regularly testing a business continuity plan to ensure that healthcare services can continue uninterrupted in the event of a disaster. To ensure operational excellence and patient data protection, Healthcare organizations must integrate the trust services criteria of security and availability into their operational framework. This involves 1. Developing policies and procedures, establishing clear policies and procedures for implementing and maintaining the controls required by SOC 2. 2. Providing training and awareness, providing regular training and awareness programs for employees on the importance of security and availability, as well as their roles and responsibilities in maintaining these controls. 3. Continuously monitoring and evaluating the design and operating effectiveness of controls, identifying areas for improvement, and implementing remediation efforts as needed. 4. Performing regular risk assessments, conducting regular risk assessments to identify potential threats and vulnerabilities, and implementing controls to mitigate these risks. 5. Engaging with third-party vendors and service providers to ensure that they also meet the trust services criteria of SOC 2, particularly security and availability. By implementing these controls and integrating the trust services criteria of security and availability into their operational framework, healthcare organizations can ensure operational excellence and patient data protection while also meeting the requirements of SOC 2 and HIPAA.